CSM with vertebral artery dissection, VAD, particularly due to the possibility of overstretching the artery during forceful rotational manipulations, Najir et al., 2003. The site most often implicated in such injuries is the atlantoaxial joint. Despite these concerns, the overall occurrence of VAD as a result of CSM is considered very low, with estimates suggesting 1 case per 5.85 million manipulations, Haldeman et al., 2002. Furthermore, current evidence does not firmly establish a strong causal link between cervical manipulation and stroke, Haynes et al., 2012. Still, the possibility of a vascular incident cannot be ignored. To mitigate potential risks associated with VAD either caused or worsened by CSM, clinicians are advised to proceed with caution. The World Health Organization 2005 has identified several absolute and relative contraindications to spinal manipulation. Red flag symptoms and conditions where manipulation is inadvisable include long-term use of anticoagulants, specific blood disorders, connective tissue diseases, congenital vascular anomalies, and previous cerebrovascular incidents. In addition, Dr. May, 1999, issued 5 specific precautions to reduce the use of rotational thrust techniques in individuals at higher risk. Guidelines later adopted by the French Society of Orthopedic and Osteopathic Manual Medicine, SOFMOO. The role of breathing in manual therapy. Introduction. Breathing is the most essential function our bodies perform, forming the foundation of human life and wellness. On average, a person breathes around 20,000 times per day, Criven, 1963. Research has shown a clear link between efficient respiration and optimal health. The way a person breathes offers insight into the condition of various body systems, such as the respiratory, biomechanical, and nervous systems. Clifton Smith and Rowley, 2011. Within the field of manual therapy, a patient's breathing pattern is just as significant as the amount of pressure or force applied by the therapist. Because proper breathing fosters physical relaxation and enhances mental focus, manual therapy techniques are often synchronized with the patient's breathing rhythm. Practitioners frequently ask patients to take deep breaths or exhale during manipulative procedures to promote comfort and effectiveness. Despite the importance placed on breathing in clinical practice, the significance of breathing during manual techniques is rarely highlighted in academic literature or textbooks. This section explores the critical role breathing plays in manual therapy and outlines the underlying physiological processes of breathing, what occurs during inhalation and exhalation, as well as the biological impact of breath holding. Understanding the physiology of breathing.
Are you for real?
From a physiological perspective, breathing refers to the exchange of gases, specifically the intake of oxygen, O2, and the release of carbon dioxide, CO2. Since this process involves the transfer of gases between the body and its environment, it is often called gas exchange. On average, adults breathe between 12 and 20 times per minute. Barrett, Barman, and Boitano, 2010.
Oh, Jesus!
Although breathing seems straightforward, the underlying mechanisms are intricate and multifaceted. How breathing works. Breathing is a complex function that operates under both voluntary and involuntary control. Although one can consciously alter their breath temporarily, the process itself is predominantly automatic. It is regulated by the respiratory centers located in the pons and medulla oblongata of the brainstem, which send rhythmic signals to the lungs to initiate respiration. Shear, Butler, and Lewis, 2001.
I don't like that one. I don't like
Breathing consists of 2 main phases, inhalation and exhalation. Inhalation, or inspiration, involves drawing oxygen into the lungs. During this phase, the diaphragm, a dome-shaped muscle separating the thoracic and abdominal cavities, contracts and moves downward. This movement increases the volume of the thoracic cavity. Simultaneously, the external intercostal muscles contract, causing the ribs and sternum to lift and move outward, which further expands the chest cavity. As a result, the pressure inside the lungs drops below atmospheric pressure, allowing air to flow into the alveoli. Shear et al., 2001, Novotny and Kravitz, 2007. Exhalation, or expiration, by contrast, expels carbon dioxide from the body. When exhaling, the diaphragm relaxes and returns to its original curved shape, decreasing the volume of the thoracic cavity. The external intercostal muscles also relax, drawing the rib cage back down This leads to an increase in lung pressure compared to the atmosphere, thereby pushing air out of the alveoli and into the external environment. Barrett et al., 2010, Standring, 2008, Novotny and Kravitz, 2007. Effects of holding one's breath. The physiological consequences of holding one's breath are multifaceted. Breath holding is a conscious act that can be influenced by emotional state, lung capacity, and reflex responses related to blood chemistry. When an individual holds their breath for an extended time, they may experience dizziness, lightheadedness, or even fainting. However, breath holding until loss of consciousness is relatively uncommon, and the literature on this phenomenon remains inconsistent. Scow et al., 2015. Typically, during voluntary breath holding, the partial pressure of oxygen in the blood drops while carbon dioxide levels increase. Lin et al., 1974. These alterations activate both central and peripheral chemoreceptors, which alert the respiratory centers in the brain to restore normal breathing. In some cases, this may trigger involuntary respiratory efforts. However, how breath holding affects the function of respiratory muscles, such as the diaphragm and intercostals, remains unclear, and more research is needed to fully understand these changes. Parks, 2006. Why breathing matters. Breathing is essential for sustaining life, ensuring that oxygen is delivered to vital organs and that waste gases are efficiently removed. Without an adequate supply of oxygen, organ systems quickly begin to fail. The brain's function deteriorates, and cardiovascular dynamics are severely disrupted. Conversely, if carbon dioxide and other waste products are not effectively